The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we're looking at children's health challenges with a different perspective, one that includes critical thinking, one that's not afraid to give you the honest truth. We may actually give you advice that's contrary to what you're commonly getting from your, in this case, dentist or dental expert. Our guest today, we're having back Dr. Thomas Lockensgard. Welcome back, Dr. Tom.
Hey, Dr. Paul. Thanks for having me again.
Oh, it's so great to have you. I did not give you the opportunity last time we were together to really delve into your new book, Matters of the Mouth. And I think before we get into that, because this book is so much more than just a dental book. It's a book. It's a guide to healthy living, to longevity, to everything.
It's a handbook.
It's an amazing handbook. But I'm curious, maybe for starters, just to get a sense of what your dental career or medical career, how it evolved. What was the main focus of your practice and how did that evolve?
Well, the main focus of my practice, like I think we said last time, when I got started in Minneapolis, Minnesota, was just drill, fill, and build dentistry. I mean, if there was a spot on a tooth, you drill it and you put some amalgam, which is silver or mercury in your mouth, and you let it go. And I got really tired. I got really kind of bored with dentistry because I just didn't feel like I was helping anybody, and that was kind of important to me. I mean, why would you go into any field of medicine and then not be able to help? So I just started kind of listening and attending different seminars. And a friend of mine who was an oral surgeon started a study club in Fargo Dare, don't you know? And he was great. And we started expanding the horizons and started looking at different options as far as what we could do insofar as helping people with common problems. When I moved to Minneapolis, Minnesota, to continue my practice, I started joining other clubs and groups, and one of the first ones I joined was IAO, the International Association of Orthodontics. So I was flying all over the country and learning things about your teeth, but I was also learning things about your body and how you could help your body and natural ways to take care of your body. I learned about enzymes. I learned about gut function and all this kind of stuff that I'd never heard of in dental school. And so that really opened my eyes and ears to a different approach. So I got a degree in the IAO, and then I started practicing orthopedic orthodontics. But then I continued my search, and I went to naturopathic medical school, and I got a degree as a naturopath. So then that kind of opened my eyes, and then what had happened is in my practice, people would start asking me, well, what about this? What do you know about this? What can I do for this condition? And so I started making a protocol list. I said, that's an interesting, let me go home and research that. And when they'd ask me a question about gut function or gut dysfunction or whatever. And so then I would put together a protocol, and you can find those on my website, drlockensgard.com. And they're just 2 and 3 page protocols that can help you out with an issue, with a specific issue. But in the end, people, as I started to assemble all of these protocols, I didn't know what to do with them. My wife was like, "What, you going to throw these away, Tom, or what are you going to do?" I said, "Well, I think I might have to put them in a book."
There you go.
So that's where the book started. And so then I had all these notes and stuff that people wanted, and I thought, well, this is kind of valuable. So I started with Greg Webster, a friend of mine, and I mean, it took a long time to write this book because there's so many issues.
Yeah, no, this your book, Matters of the Mouth. It is a masterpiece, and it's so much more than just about the mouth. You also have a 10-step action plan to clean up your mouth. Yeah. Do you want to speak to that at all?
People will say, well, so what do I do? And so I said, for those of you that just want to know, hey, what do I do? What do I do? How do I do it? Here's the 10-step plan to clean up your mouth. Number one is to remove all metal fillings properly. And that was another big part of my practice, was that you have to remove metal fillings, mercury, which are highly mercury. They're about 53% mercury, because that mercury is a killer too. And if that gets in your brain, you're in real trouble. So remove all metal fillings properly the right way. And you need to go to somebody who's been trained in that, the IABDM or the IAOMT, like we said last time, to get on to the proper program. And then you have to evaluate all dental crowns and bridges for residual metals. So you can do testing, because a lot of porcelain jacket crowns will have mercury underneath them.
Interesting.
And metal
do the root
underneath.
canal with mercury and then top it off with a porcelain crown.
Yeah, with a metal understructure. How brilliant is that?
I'll tell a story on my family. I adopted a bunch of kids. I have 9 or 10 kids, depending on how you count. But a lot of them came to me with no prior dental care or wrong dental care, where they had a bunch of mercury fillings. They call them silver fillings. Yes. So we lined up these kids. I think there was about 6 kids getting dental work, a total of almost 30 fillings that needed to be removed properly. And it was a process of damming up the tooth with a rubber dam, and you've got a hose to suck off the fumes.
Yeah.
Quite a process.
Yeah, it's very much a process.
Yeah.
It's a necessary process.
Oh, yes. Otherwise, you would be inhaling these fumes.
Well, and it's not just the patient. I mean, one patient comes in and then he leaves. What about me and my staff?
Right.
That's a real danger.
A real exposure, environmental hazard for you all.
Yeah, for sure.
Yeah.
So and that leads to memory loss. And by the way, do you know what the 3 signs of anti-aging are? No, I'm sorry, the 3 signs of aging. The first one's loss, and I can't remember the other 2.
Real quick, memory loss. I remember the other 2. I am suffering a little bit from that at times.
Yeah, I know. I think it's from the chemtrails, but that's a whole nother topic.
Well, I had mercury fillings, but they were removed 25, 30 years ago, but nevertheless.
So check all root canals and extraction sites for infections and jawbone cavitations. It's one thing we didn't talk about with jawbone cavitations. If you've had any teeth removed, you need to have an x-ray and make sure that there's no hole there and there's no infected process.
Yeah.
Okay. And that's a big deal. Be evaluated for gingivitis, periodontitis, and gum recession. We already kind of talked about that. Decay being the number 1 disease state in the world, gingivitis being number 2. And gingivitis is repairable, by the way. And then periodontitis. And when removing infected teeth, make sure to remove all of the infection. Then use PRF, called protein-rich fibrin. We'll maybe get into that in another session. Protein-rich fibrin after ozonating the sockets. So you actually take some of the blood, you spin it down, and then you take the clot and you put it back into where the hole is, where they pull the tooth.
Yeah.
And so then you gotta make sure that that's cleaned up. And then ozone, I'm a big fan of ozone, so we use ozone.
I am too.
That kills everything that's bad.
Yep.
So, and then have orthodontics for you and or your kids done orthopedically, like we talked about in the first session. Have your TMJ areas checked, including cranial sacral issues. So if you're wobbling around, I mean, the cranial sacral thing is a whole other matter. Avoid fluoride in all toxic dental products like the plague. And then number 9, test for heavy metals, serum compatibility. That's a good test to have if you're wondering that, hey, am I allergic to this stuff or what? You can go to any dentist in the know, and then that'd be a good title for practice, dentist in the know.
Yeah. How do they do that? How do they test for the heavy metals?
It's a blood test.
Oh, it's a blood test. Okay.
And you send it to a special lab in Colorado, and then they'll tell you what you're allergic to. And then detoxification and remineralization protocols after steps 1 and 9. That's it.
You say detoxification and passing. That is a huge need in our world today. We live in such a toxic world. What are your favorite first 1, 2, and 3 ways of detoxing? What's your initial approach? How about that?
Well, the initial approach is to use a company who specializes in that. Quicksilver Scientific is a real good one.
Yeah.
Quicksilver Scientific is in Colorado again. They've got a thing called liver cleanse push.
I did the Quicksilver testing on myself some years back, and I was in the 99.99 percentile for mercury. I
Wow.
am loaded with mercury. I think it was because
Wow, Paul.
I know it's bad. That's surprising that I'm still have any memory left. I've done a fair amount of detox, but the why of it all was I think I was eating a lot of large fish.
Yeah, right. There you go. Another good way to detox, and I have one up in my office, infrared sauna.
Yeah,
and now
sweat, right?
red
You just
sweat, and then red light there. Well, with an infrared
with the
light.
red light.
And now,
Yep.
now there's red light therapy. My friend Billy Weiss and Scott Laird tell me that this is the way to go. In fact, when I was hanging around waiting to get on your show, I did a detox, infrared detox.
That's why you're glowing. That's awesome. Are there any detox approaches that you can do with little kids?
That's a good question. I'm really not sure about that one. I'll keep you
I
posted.
don't know if you've had any experience with zeolite. I understand it can
Yeah.
bind heavy metals.
I've heard good things about zeolites, and then I've heard some bad things about zeolites.
Yeah.
But
Okay.
I've used zeolites in the past.
So
Yeah.
I want to ask you before we run out of time, there are some controversial issues or issues that just aren't addressed properly that I want to run by you. So one
Sure.
is raw milk. What are your thoughts about milk in general and then raw milk specifically?
One of the reasons why we moved to Florida was because we met our next door neighbor before we bought our house. She goes, there's a farmer that comes here and he has raw milk and whole, raw eggs and all this kind of stuff. And he said, bingo, that's it. We're moving. and so I'm a huge fan of raw milk. It has so many good things in it. And again, it's in the book.
Yeah.
About raw, there's 2 pages of the ingredients in raw milk
Yeah.
that are healthy.
Enzymes,
Yep.
nutrients.
Plus, it tastes good.
It's so different from the pasteurized, homogenized. Yeah.
Right. So
Yeah.
now, if you're gonna use pasteurized and homogenized, buy whole milk. And there's this milk called A2 milk, 4% whole milk. Stay away from skim milk, margarine. That's all crap.
Right.
There's
Yeah.
no reason for that.
And
2%.
go organic if you can.
Yeah, organic if you can. That's right.
Yeah. So you also talk in the book about iodine. What are your thoughts about iodine and why is it important?
Love iodine. Iodine is important to convert T4 to T3.
The active form of thyroid.
Yep. And it's an alkalinizer. You can't become alkaline unless you have proper iodine levels in your body.
Oh, that's huge.
It's huge.
Having an alkaline state is anti-cancer. It promotes health in so many ways.
There's 4 compounds you need. You need magnesium, you need selenium, you need iodine, and you need, what is the other one?
Oxygen.
D3.
D3, yes.
Oxygen, yeah, right, but D3. Yeah. People that have those in their diet have very low rates of cancer.
That is good to know. That is really good to know. It makes sense.
Yeah.
Do you have a comment about salt? And do you have
Yes.
a comment about sugar?
I do. Stay away from sugar. If you're going to use sugar, use D-ribose or xylitol. The thing about salt is that there's processed salt and there's non-processed salt.
They do iodize the salt, so I always thought of that was
It's not enough. It's not enough.
iodine.
You got to use Himalayan pink salt or unrefined Redmond sea salt.
And do those salts have iodine?
The increased voltage, the decreased blood pressure because they have potassium in them. It decreases AFib, it decreases fatigue, and there's macro and micro. It contains over 80 trace minerals.
Wow.
So
I have a daughter who goes everywhere with her Himalayan salt, so I have to
she's spot on, Paul.
Give her some props for that.
You got it. Yeah. So we just threw the other stuff out. And in fact, I had high blood pressure. So when I first moved down here, so I went into the doctor and he's like, you got to be off salt. And I said, Doc, no salt. I said, no, you're talking about refined salt. He said, no, I'm talking about salt. You can't have any salt. I said, yeah, but there's Himalayan pink salt. And I got into this discussion. Let's call it a nice discussion with him. And I just walked out of going, I'm not
Yeah.
going back to this guy.
Salt has been vilified, but we actually need it.
Right.
Yeah.
We definitely we need it for voltage. Your cells need, your cellular membranes have a voltage, and without the correct voltage, like I said, the membrane dies and bugs wake up, and then the bugs start crossing the membrane. So yeah, that's a big deal.
Yeah. You have a whole bunch of myths in your book.
Yeah.
Do you have a few favorites that you want to maybe just share? Because, people believe what they're told, and a lot of the things they're being told are just myths.
My favorite is the government has my best interest. And then secondly, my physician has my best interest.
Yeah.
And then Big Pharma has my best interest. Nothing could be further from the truth.
Yeah, they do not. We have to, viewers of this channel are pretty on board with this, but we have to be in charge of our own lives. We've got to absolutely make the decisions for our children, for ourselves. And honestly, if you're getting information from Big Pharma, from the news, from public health officials, from most mainstream doctors, whatever they're telling you, the opposite is probably what you should do. That's exactly a sad statement to make, but it's the truth.
It's the truth.
Yeah, it's crazy.
Yeah. And then there's a bunch of formulations in this book. A lot of lectures that I went to where they would list out things, 1 to 21, 1 to 12. Here, what do I do if I have this? What do I do if I have this? How do I get, more alkalinity? And how do I stay away from cancer? What do I do there's a whole chapter in here on cancer. It's number 17. And I got most of that from Ty and Char Bollinger.
About cancer. Yeah.
So
they're doing some good work in the cancer.
They're doing some great work.
Can you think of any aha moments in your career or in your life?
I can think of a lot of aha moments. I think the biggest one was when I found out mercury was bad for me.
For a dentist, that had to be like, what am I going to do, right?
Yeah, I go, well, I was going to quit.
Yeah.
That's what I was going to do.
I guess that's similar to mine, where I realized vaccines were harming children. It's like, whoa, what are we doing here? One of the main things I was doing, right? Vaccines. And for you, one of the main things you were doing was drilling and filling with a toxic substance, mercury.
Right. Do you remember calomel?
Calomel. What? Yes, but remind me.
Do you remember mercurochrome?
Yes.
Well, when that was mercury, toxic mercury. In a package whereby you put mercurochrome. I mean, I remember my mother used to do this to me.
Put it on the wounds, right?
Yeah. So we were in Washington D.C. in Mount Vernon, and they were talking about George Washington, and they said the night before he died, they drew 38 milligrams or millimeters or something of blood. And then they gave him a concoction called calomel, which is straight mercury. He died the next morning. I learned that at Mount Vernon, and that was a significant aha moment.
Yeah,
what, they killed the president?
Right. That's significant. What is your final sort of message to the viewers here that you'd like to leave them with? Your
body is wonderfully and beautifully made. It's crafted by the Lord God Almighty, who loves you and would do anything for you. And so pray and just know that you're special in His eyes.
That's beautiful. We forget that modern medicine, us scientists, us doctors, we think we've got all the answers and we're all so smart. And yet the real healing is all within us. And we just have. Yeah, I'll leave you with this, Paul. I've had many patients over the years turn to me and say, you saved my life. And I like, no, wait a minute, John. I didn't save your life. He saved your life. I'm just a helper to the great physician. Yeah. That's how it works. That's exactly how it works. Thank you for that. My partner does the same thing with her work with kids, and they'll say, oh, you fixed me, you healed me, you didn't know. I facilitated your body being able to heal by channeling that healing energy that we all have within us. Because it's already wonderfully made. Exactly. That's a beautiful way to end. Thank you, Dr. Tom. I so appreciate the opportunity to be with you, and God bless you. Let's get together sometime. I like the idea. Let's do it.
God bless you.
Well, folks, there's a couple books you ought to get, right? So Dr. Tom's book, Matters of the Mouth, it is a real masterpiece. And my own recent book, Vax Facts, if you have any questions related to vaccines, it covers all ages and stages from pregnancy, pre-pregnancy, all the way to the end of life. It is a pleasure always to have you join us for this show. And thank you for watching. I look forward to seeing you next week.
Tell us your name.
I'm Nancy Shaw.
And you are a registered nurse?
Yes, since 1985.
What kind of a nurse were you?
Mainly labor and delivery, maternal child health, and I also did some outpatient surgery, and then the last position I had was as a psychiatric nurse.
Wow.
Yeah.
Now, did you ever yourself administer vaccinations?
Just a little bit, and just a few times. Usually the nursery nurses would do the vaccines on the babies, thank goodness. But I did do a few, and my last job, by the end of the time that I was there, I did not want to be giving any flu vaccines, so I would just write in the information, someone else would give it, another nurse.
So you didn't want to actually do it yourself?
No. But I had many flu vaccines. I've had lots of vaccines, and I was kind of pro-vaccine. I went along with it. My children had vaccines. My dog is actually a vaccine injury patient. He's a beautiful golden retriever. He was perfectly fine. And then when he was 3, almost 4, he had a rabies vaccine, and the next day or two he started having some strange behaviors, and then he started having seizures later after that. And I didn't put it all together at first, but I did later. So anyway, so he's also a victim, and it's not fun. He has very bad seizures. It's very upsetting.
When you were at nurse training medical school, where you go to train to be a nurse,
Yeah.
what did they teach you about vaccines there?
You know, it's amazing, but they didn't teach us very much. With most medications and different classes of medications, we had to make out these intricate medication cards, and we studied, many different types of antibiotics, heart medications, many different drugs. And with the vaccines, basically what they said is that someone could have anaphylactic shock, especially if they're allergic to eggs. They might get a sore spot, and that we had to write down the lot number for the vaccine on their chart, which you don't do that with most medications. And so we really didn't learn a lot, and I had no idea, and I really feel bad. If I had known when my girls were younger, if I had known what I know now, I never would have given them all those vaccines. And most medications are the main medication, and then it's in something pretty benign like normal saline or water, something that isn't harmful. And so when you're a nurse, you're really busy. You're running your tail off most of the time. And you'll look at basic things about the medication, the dose, the route, the percent of medication that's in there. And you assume, and I'm sure this is the same with the physicians, that they're assuming that it's in something benign. I had no idea that there was formaldehyde and mercury and polysorbate 80 and 20 and fetal cells and all sorts of other viruses that get in there that should not be in there. And just assume that it was in something like normal saline. And it wasn't until I had been a nurse for a long time, had many flu shots without problems that I knew of. And then one year, it was about 2008 or so, I got a flu shot, and then I got really sick, bad flu. Not immediately after the vaccine, but you know, may have been a few weeks or a month or so. And then the next year, the next winter, I got sick again. The same thing. Got the flu shot. Got a terrible flu, and it was so bad. I gave it to my youngest daughter, and
what's your youngest daughter? The flu that you caught from the flu vaccine.
yes, well. Or that I was so, my immune system was shot and it didn't work, it didn't prevent it. So, you know, I don't know. I'm not going to say because we don't really know. But I gave that to her. She didn't give me the flu. I gave it to her. She went to the hospital and got checked, and they said she had the H1N1. She had a fever over 105, which was not coming down. I gave her the ibuprofen, Tylenol, I hate to say it, not coming down, so I brought her in. But they tested, so I knew that's what I had too. And that was like the end and the beginning, because after that I thought, I am never getting a flu shot again. And so I started doing some research on it. And in fact, I wrote a letter to our public health nurse at the hospital that I was working at. They're such a big forensic hospital that they have their own little public health department. And I told her some of the problems. And I think at that time they had banned the vaccine from a certain part of Canada, which I can't find online anymore. I think they took that information out. But anyway, I had told her things that I had learned, that you know, the efficacy is not that good and it can be harmful and blah, blah, blah. And never heard anything from her or anyone, never got a reply. But I never got another flu shot. And then when I became active against the SB 277 bill in California, because not only as a mother and a human being, but as an RN, it goes against our ethics to medicate someone against their will. And with SB 277, that is what is being asked of the nurses and the physicians' offices, that they medicate people who really don't want this, or they get kicked out of school, public or private. So I became involved with that because I thought it was such a horrendous thing. And so then it wasn't until I was actually collecting signatures to get it on the ballot this year so people could vote and say no, they don't want this, that I had some flashbacks about my daughters, and I started realizing that I think both of my girls actually had some vaccine injuries. And actually, going back to me, after the 2 years of flus, I started getting sick a lot. And I normally was very healthy. And I started getting fever blisters a lot. And when I went vegetarian, for 7 years, I never got one. But all of a sudden, so my immune system tanked. And then I had read that there was a study that showed people like me who are nurses or who get a lot of flu shots become more susceptible to getting the pandemic, the really bad flus, which, you know, the H1N1 flu is a very bad flu. And, but anyway, my daughters, it hit me that my oldest daughter, who is 20 now, she has tics. And all of a sudden, when she was 5, she's rolling her eyes back, and I thought she was having some kind of seizure. And I took her into a pediatric neurologist, and she said, oh, it's tics. She has tics. And she also had some skin condition she had a biopsy for, and I kind of wonder about that too, if it's autoimmune. And so then my other daughter, she's been diagnosed with combination type ADHD, ADD. She has a learning disability. She has a diagnosed weak working memory. So all of this has affected her in school and her self-confidence. And, you know, I had always blamed this on the fact that she was adopted and was in the orphanage too long. But afterwards, I found out more and more that there's a correlation between ADD, ADHD, and the vaccine. So I believe with her it's probably a combination. And she also has eczema, which is related. So I don't want my girls to get vaccines anymore. And when they got into middle school, I would not allow them to get any vaccines. So they have had the waivers, so they would not.
All right, so what would your advice be? I mean, you're a registered nurse, your mother, you've been through it yourself and your children. What is your truthful advice to the people of America, the people who do not know what to do?
Well, I'll say non-nursing advice. I mean, I don't think it's worth taking a risk. I mean, something else I didn't mention is we actually had 4 vaccine failures in my family, because I had the hepatitis B series because being a labor and delivery nurse. I've had them twice, and then there was a dirty needle stick, and they checked me, and guess what? I didn't have any antibodies to the hepatitis B vaccine, or to hepatitis B. And then my oldest had the chickenpox vaccine. A couple years later, she gets chickenpox, and then I had the 2 flu shots, which did not work at all. So they are not working well. There's a lot of documentation on that. I wouldn't do it. If I were younger and having children, I would not vaccinate my children. But I say to people, you need to research it, but don't just go by, what's put out there by the CDC or, unfortunately what your doctor is saying. I feel like we've been lied to. Not only the parents, but the medical community, nurses and physicians have been lied to by the CDC. And we know there are many scientists now. There's 12, I believe, in that spider group who have come out that they were pressured, and their studies are not quite what's being reported. And then there's Dr. William Thompson. So I would look at other information. I would go deeper, because the problem with a lot of nurses and physicians is that they are really not looking deeply enough. And I have family members that will not look into it. Some in the medical world.
Well, so unfortunately, it's taking all of us to live through it.
Right, right.
To get it, because we were
Right.
all pro-vaccine, as in we all
We
vaccinated
were.
ourselves and our children. So
You're right.
it's time for us to tell the truth. It's
Right.
time for us to stand up and say
Yes.
enough damage.
I feel like I want to serve physicians with a notice, with a registered certified letter that, here's this warning. Here's the facts that you're giving these vaccines that they are going to harm a certain percentage of your patients. And is that okay with you? Because unfortunately, some people are very stubborn, and they're not looking at all the facts. They just go by, smallpox and polio, which that's another very involved story, which we were not told all the truth about that. And in fact, my brother had polio, my oldest brother, and he's fine. And most people don't know that the majority of people are fine with polio, that it's kind of like a cold. They may not even know they get it. And of course, there are some people who were harmed. And, this also, the potential link of DDT, which my brother was exposed to in our home. My father told me recently. And another vaccine injury, my father, who is 94 years old, he's been getting the flu shots. He doesn't realize this or believe it, but there are studies on PubMed linking polymyalgia rheumatica with the flu vaccine. And my father has that, and he's been stuck on prednisone for years now because he had so much pain he couldn't even get up, could not walk. And of course, prednisone will take a toll on your body. And then my niece, my beautiful niece, was 5 when she was diagnosed with leukemia, and she's an identical twin. And this is how I ended up moving to California to help out. And she died when she was 9. And now I'm seeing some links with the vaccines to leukemia. And we knew another boy when he was about 5. He got leukemia. He's fortunately lived. But so it's just, I would tell people, you know, look into it deeply. Don't just go by what your doctor says. Look into it and weigh the risk, you know. I had measles as a child. I had whooping cough. I had German measles, and I had, I'm missing one, measles, German measles, pertussis. I don't think I had mumps. Chicken pox. I had all of that. We all were getting this. All the neighbors. I lived in a busy area on Long Island, and my father too lived in a part near New York City. He doesn't know anyone who died or had terrible ramifications, complications from these diseases. I mean, it is possible, it can happen, but in the United States with, you know, our good quality medical care and nutrition and sanitation and health, you know, better water, you know, measles was not a big deal at all. It was nothing. I was watching TV with my brother. We had it the same time. That's my memory, is sitting there watching TV with my brother. And people are so afraid now because of the media. Right, the media.
Well, we're really, really grateful to you.
Oh, thank you.
Thank you so much for telling your story. We've got a lot of stories.
Thank you.
So we better go on with the
Thank
Thank
you.
you. You're amazing.
Thank you. You're amazing, and you too, Anu. I appreciate what you
Anu
do.
is amazing. He's doing about 5 jobs. He's a driver, editor,
He's
cameraman.
Jack of all trades.
Everybody at the moment. Well, everyone's away. All right.